So just by way of background, I am from Montreal, petit gars de Verdun. Played hockey here for way too many years and actually skated at the old Forum. It was the best day of my life. But to make a long story short, an American girl found me at McGill where I was doing my law degree and had done my undergrad, and she spirited me off to the US. So I've been there for 27 years, primarily in strategy consulting, started a few companies and sold them, and ultimately raised a venture fund with a focus in life science technologies. I am, in fact, a recovering venture capitalist. I'm in step 5 of a 12-step program. With medication, I find I can get through most days. I have raised about $200 million or so for startup companies over the years, and I have 10 companies currently in my portfolio. And I'm typically involved as a C-level advisor to early-stage companies. I love them. My wife thinks I'm crazy because so many of them require so much work and take so long to get to a good endpoint. I wanted to share with you a little bit because one of the things that's happened in the States is that folks don't really realize how sad the situation is from a life science perspective, both in terms of funding, regulation, and in fact, basic research capitalization. Before I go any further, I have to tell you that half of what I'm going to tell you is probably wrong. It's my opinion. You can choose which half you like, but please don't hold me responsible for any of it. Recently, we sold at Boston Harbor Angels we had a fantastic exit of a company called Smart Cells, which was bought by Merck at Christmas last year. Smart Cells was a new generation of angel-designed, angel-specific life science therapeutic investment. And why is that? The technology was insulin, but in this case, insulin caught up in a binding moiety. What I mean by that is if you think of a chocolate chip cookie, the dough is the binding moiety, the chips are the insulin, glucose hits the insulin, it cleaves the bond, and it's released into the bloodstream. So it's like an artificial liver, but you inject it twice a day. We sold that to Merck for $100 million in cash upfront, $500 million in milestone payments, and 12% royalties on global sales for the next 20 years. We did it in 3.5 years, from PhD thesis to exit. We did it with $6.5 million of risk capital. There was a further 6.5 or 7, and these numbers are approximate. I forget what exactly we did. But there was a further 6.5 or 7 million that was what we call non-dilutive capital. NIH money, like the NRC money from the Juvenile Diabetes Research Foundation. They're looking for a solution to type 1 diabetes. So that we as investors looked at our invested $6 million of risk capital. We only put in $2 million to get the drug all the way to the proof of concept. The $4 million was to make our bank account look good to Merck and to Bristol Myers Squibb. We ended up having an auction for this technology. Why? It's the first time anybody's paid $100 million down for data based on animals. We have no human data. Merck bought it because Americans are fat, diabetes is rampant, insulin is well characterized and low risk. This was really almost a drug delivery device. It was almost I think of it really more as a medical device rather than a therapeutic. We weren't dealing with a new target, so we could use a very modest amount of capital. And in this case, there were only 3.5 employees in the company. The half employee was very small. And it's a virtual company, but we were able to create a sufficiently robust data set that we could run an auction. Why am I telling you all of this? I'm telling you all of this because I need Pierre again, because I forgot to keep moving his little mousey thing here. Sorry. I'm telling you this because the investment climate in the United States for life science companies is very, very difficult. Today, what I would like to leave for the entrepreneurs among you is some new ideas about ways of thinking about raising money in an otherwise very, very ugly environment. You know, Canada has always had Nobel Prize caliber talent, and it's been recognized as recently as today. Quebec is unparalleled in terms of investment both by the feds and the provincial government in both entrepreneurship but in life sciences. The quality of, we use Montreal in particular for clinical research for some of our clinical trials because the physicians, the support staff, the caliber of talent is extraordinary. When I was raising money in Canada, raising my second fund, I did some analysis and I was able to demonstrate that per dollar of NRC money, Canadians are infinitely more productive than Americans are in terms of patents and disclosures. It's a stunningly productive model. Tech transfer was awful. It's gotten better. But there's something that you understand that Americans don't get, which is the concept of a national healthcare system, which is, notwithstanding all the bullshit, pardon me, that's an English word for misinformation, going on in US politics. It's almost inevitable because of some of our cost problems. And the other thing that most of us in the States find is that Canadians are nice to work with. They generally don't carry guns while they're jogging, in contrast to some American presidential candidates. Now, the purpose of my talk today, which I'm splitting into two pieces, the technical part will be with pictures because I can't do anything without pictures. Otherwise, I'd have to do the, shadows, is how do you raise money in the US and in New England in particular? How do you get to know your customer who happens to be your local angel, your local philanthropic organization for the area that you're serving? I'm going to talk a little about venture capital. I think venture capital is fundamentally broken. And for most early stage companies, you will not ever raise a single penny from a venture capitalist. You will go to lots of nice meetings, you will have donuts, but you will not raise any money. And the reason why I want to get this across to you is because even at the angel community, we look at 50 companies to invest in one. Our little angel group of 50 people, we've invested probably in 20 companies over the last 5 years. We've had 2 good exits. We have had way too many dead dogs. But the key thing to remember is your competition, entrepreneurs, is in fact another social networking site. It's another thing that people can make out of some software. I was on the panel at IBM judging the global business plan competition. We had a young guy walk in the door. He'd put $60,000 into his social networking site. And guess what? He had 500,000 discrete members. He was making money in the sense that he had revenue. He had been in this for about 6 months. It looks like he had been conscious for about 2 of those 6 months. And he was doing great. I think it was for left-handed albino yak herders. It was a very specific site. Meanwhile, the next guy comes in and he has a cure for treating glaucoma, which causes the single biggest cause of blindness in North America. He's got $5 million into it. We're into it for 2 or 3 years. He needs $5 million to do $5 million more to go through a PMA through the FDA. May not get there, may run out of money, may blow up, may not work. Which one do you invest in? The fail fast, little bit of capital, go like hell, it could be the next Google, who knows? Or the one that you're pretty sure that 75 to 90% of them will fail and they're going to cost at least $15 million. So from that perspective, I think it's very important for folks to understand that you have competition when you're raising capital, and if you're in the life sciences, you're starting with basically with your feet shackled together. And that is the starting point. And I'll finish up by saying a key thing that Canadians were always worried about is that Americans, big bad ugly Americans, I guess I'm quasi one now, would come in and then find the good Canadian companies, move them out of the country, and bring them down to Boston or Minneapolis or San Diego, which frankly, I've been in Montreal in the winter. I would go to San Diego. We're not interested in doing that anymore. because we don't want you to go through the FDA anymore. We want you to go to Europe. So we frankly would rather you relocate to Birmingham, not Alabama, England, because the FDA is now a full impediment to getting anything done in the United States. When you look at it carefully, what you'll discover is that in the United States right now, let me just pull up the data here. The number of drugs approved in the last 5 years is 21 versus the number 36 the 5 years before that. The number of new molecular entities, the approval time on average now is over 20 months versus 12 months 2 years ago. The average time for a 510-day clearance used to be 60 days if you basically had a straight 510K looking for substantial equivalence. That is now in excess of 6 months, and I've seen it go out to 7 years for a 510K or a PMA. The FDA is broken. We do not know how to get stuff through it anymore, so we're all going to Europe, and the food's better. And the VC model is fundamentally broken as well. The average investment for a med tech deal today is 115 million versus 50. The average exit for med tech deals is 60. I think you can run the math. Time to IPO right now, it takes $50 million in 6 years. In the old days, that was until 2008, which is really a long time ago. It's 115 million in 9 years now. The return to venture capital investors, that's the limited partners putting money in venture funds, post-2000, which is when the last bubble was, and when there was an IPO market, and we were all really happy, and it was such a great time. It was perfect. Is really awful. The average venture fund is not returning capital. So in other words, the money you put into the venture fund, you don't get it all back. Never mind a return on your investment. You are a top quartile performer in a 2000-2001 vintage if you simply return capital, which is worse than treasury bills. Finally, not a big surprise, because of these lousy performance, last year, U.S. venture funds raised $12 billion. In 2007, they raised $31 billion. They don't have any money. When you come to Boston, people think you're going to talk to venture funds and they have lots of capital. Of the 47 funds investing in life sciences, only 22 have fresh powder. Almost none of them will do early stage. They will only do late stage investments. So as we go to our next session, and I think I'm probably into overtime at this point, critical 3 conclusions before we talk about a new way to go to market and raise money. One is, I don't know how many of you watched the French version of Monty Python and the Holy Grail, but there's a scene there where the killer rabbits are attacking the knights. And when the killer rabbits are going after the knights, the simple thing the knights all did was they yelled, "Run away, run away." And that's our first conclusion. Run away from the FDA, embrace Europe, and go for CE approval. Also a great place to start pilot markets. Second conclusion, VC funding will be very rare, very expensive, stunningly expensive, and angels are out investing VCs at least 2 to 1 at this point. In Boston today, the better deals are being done by the angels, not by the VCs, period, full stop. And I would argue you're getting a better caliber support in terms of skill sets from the angels than most of the VC funds now. Conclusion number 3, things are a mess. If you're a life science investor or entrepreneur or incubator supporter or running a university hoping for tech transfer to do great things and get these wonderful technologies into the marketplace, the system is fundamentally broken right now. And what you saw as a huge impediment to the introduction of Canadian technologies and life science solutions to the global market, the US is not an automatic panacea to get you there. You really have to look very carefully at what you're doing at home and what you can do in collaboration with some of those who believe that we have the right idea. But again, I would emphasize that 50% of what I say today may be inapplicable to you, or I'm wrong. Just pick your 50%. So I'll see you in a little while. Have some coffee. Merci beaucoup. And I'm sorry the Bruins won. We tried to let the Canadians win really hard. But That's the way it went. Thank you.